Hi, everybody. So I'm way down south in Africa. Tonight, it's now almost 10 o'clock p.m. I'm in Pretoria, the legislative capital of South Africa. And I had the privilege of working with Dan and the Collega team 2 years ago, where we did quite a nice project here in the medical health insurance industry, setting up a HIE. And so similar to Sarah, I was involved in driving the competitive dialogue procurement process. So that was just from a background perspective. So I'm very familiar with the Collega culture and the method of working, and happy to be back on this platform again, Dan. In terms of mental health, I think the interest for me lies here in that in South Africa, we're going through a phase now where the country is probably in its ebb on the social curve, having to rebuild the country after many years of political strife. What we have seen throughout the COVID period is great job losses, and I mean it's a phenomenon all over the world, but I think more apparently in South Africa, and a lot of people have been left destitute. A lot of people have suffered in losing jobs and so on. So I think for us in South Africa, rebuilding the country, focusing specifically in mental health care, that would be in areas of interest for me. Veronica, it's quite interesting that you mentioned platforms. I listed on the blog page earlier tonight that my specific interest would be to understand more around the digital collaboration that one can move into private and governmental healthcare sector to the benefit of those communities. Although we're in Africa, we are very well connected. Dan, being an ex-South African many years ago, would know what I'm talking about. So our digital neural networks here in South Africa is quite advanced. The internet proliferation on many pervasive devices throughout all communities, rich and poor, are quite pervasive. So I think we're set to roll out mental health care solutions, and especially in the rural areas, in the big townships for our less privileged people in South Africa. So that's my area of interest, to learn from this process of yours and to collaborate where I can, based on my past experience with Collega. Regulatory perspective on these prescription medication, especially in relation to mental health care and genetics. From you would recall during our efforts together here in the private healthcare sector, a lot of regulation exists. So I would be a little bit more hesitant to launch a pilot project in the private healthcare sector. But I would rather think that in terms of the government and parastatal sector, where medical health care is provided to the bulk of South Africa's citizens, that the regulation framework is rather less onerous than the private healthcare sector. And it's really in that community sector that I believe that the biggest help is required for mental health care patients. So certainly I think that, when you approached me a couple of weeks ago with this initiative, this is exactly what I was looking for. So I would be keen to pick up a conversation with Veronica and yourselves to see if we can't, involve the government sector here in South Africa, and maybe pick up a pilot project for that group.
Actually, I think that there's a good possibility for other reasons, and we should definitely continue the conversation.